Hello, my name is Jonathan Lever, and I'm pleased to welcome you to Better Health Partnerships webinar on Ages Healthy Stages, a multifaceted program focused on creating early learning environments that develop healthy habits for children ages 0 to 8 in Cuyahoga County. The program is supported by the Cuyahoga County Board of Health and other funders and leverages the 32 hours a week that children spend in early childhood care centers and educate them to nurture, to plant the seeds for a healthy lifestyle at an early age. I'm delighted to introduce our speaker, Allison Patrick, who provides administrative and fiscal oversight of the Board of Health programs that serve young children and mothers, using the maternal and child health, farm to school, and early care programs and early ages healthy stages. She provides technical assistance to school districts and other early learning providers to improve healthy eating and active living environments. She served leadership roles on several collaborative initiatives and a Bachelor's of Science in Medical Dietetics and a Master of Public Health from Ohio State University. Allison starts, I'm just going to go over a few housekeeping items. Your computer and phones are in mute right now during the presentation. We'll allow time near the end for questions. Please put your question in the question box, and we'll just address it before the Q&A session at the end of the presentation. If you leave a survey at the conclusion of the program, please take a moment to fill it out. Value the surveys and your interest in topics that you may want to hear more about. Thanks so much, and I'm going to turn it over now to Allison.
Thanks, and good afternoon, everyone. I appreciate you taking the time today to hear about our work in early childhood health. Our work with our community partners on creating healthier early childhood environments. I have a lot to unpack here today, so I'm going to hit the highlights of each slide, and I'm happy to answer questions either at the end or via afterwards. So I just want to start by acknowledging our funding partners. I would not be sitting here today without the amazing support of these organizations. In particular, the Mount Sinai Healthcare Foundation has been a large and standing supporter of our work, in addition to the Ohio Department of Health, the Foundation, Nemours, and Tufts University. So when I say early childhood for the purposes of this presentation, I'm generally talking children ages 0 to 8, but just in case you're unaware of what early childhood obesity looks like across the state, this is overweight and obesity rates across kids ages 2 to 5, and this is 2014 data. So this is the most current data we have as a state in understanding where our early childhood obesity issues lie. And so not unsimilar to other age categories, we know that kids start overweight and obese, even as young as 2 to 5 will likely carry that through their adulthood. And so we were very fortunate enough to have a number of thoughtful partners dating back to 2012. We're really starting to look at the early childhood obesity issue and supported some early childhood obesity prevention summits where we've started to think about early childhood interventions and best practices, and then the following year kind of thinking through the lens of early childhood wellness policies. At this time, there was very little funding and kind of attention on the early childhood obesity issue, and a large body of work and funding was focusing on kids during school years. And so this was really kind of a way of kind of moving toward what the trend at the national level was thinking that we must start even earlier if we want to impact the rates further along. So we were very fortunate that Mount Sinai Healthcare Foundation, as well as the Cuyahoga County Office of Early Childhood and Invest in Children, Starting Point, really came together and started to encourage us to build momentum and think about how we would begin to institutionalize the energy from our summits, come together as a community to really spend some dedicated time and effort around early childhood obesity. And so that we actually convened a number of organizations that provided input and support for the county's first early childhood wellness plan, implementation of a program that used to be called Healthy Children, Healthy Weight, and is now called Ohio Healthy Program, and I'll talk about that in a minute. Also had the opportunity to begin connecting with partners across the state and at the state level, and we joined an effort called Ohio Early Childhood Health Network that is really kind of a statewide coalition of similar community efforts and other stakeholders really looking to impact the issue and raise and elevate the importance of the issue of early childhood health. Started to materialize for us. We first began to think about, well, why it matters, and us that came with a recognition that healthy habits needed to start before kindergarten. And so we really started to look at the opportunities within early learning environments to provide and help shape those healthy habits for kids. So we know that approximately 38,000 kids in the county spend some time in early learning environments. On average, it's about 32 hours a week. We know that they're 4 times less likely to be obese teens if they enter kindergarten at a healthy weight. And we know that kids that enter kindergarten healthy are ready to learn and impacts academic outcomes. Really the foundation and the lens we were using to look at our first iteration of the Early Childhood Wellness Plan that was launched back in July of 2015. And our goal was to really shape opportunities for young children in the county to establish a healthy lifestyle. Our focus at the time was early care and education providers, families, and community stakeholders, and we crafted a number of goals and objectives around infant feeding, healthy foods, physical activity, and family wellness. The approach began and has been maintained to this day through a policy, system, and structures approach. And rather than focus on individual behavior changes and personal responsibility, we were really working to change the environmental landscape within which young children opportunities for health. So we adopted 2 strategies, and we have maintained this approach this day. The first strategy is looking at improving environments where children live, and this is through the Early Ages Healthy Stages Coalition. And we also look at improving environments where children learn, and this is through our initiative called Ohio Healthy Program. And so I am going to go into further detail about each of these. So Healthy Stages is our county-wide partnership between ECE providers, community organizations, healthcare, social service, business, families, really anybody who's interested or has a stake in the ground related to early childhood health. And we work to make the healthy choice the easy choice for young children and their families in Cuyahoga County. The mission is to work together, and that is something that we are very committed to create these healthy environments. Through our strategic planning process, we broadened our vision slightly, and rather than focus on 0 to 5, we now work to provide all children ages 0 to 8 with opportunities to establish their healthy lifestyles in environments where they live, learn, sleep, and play. The values of our coalition are that we are all about equitable opportunities for all young children. So regardless of where you live or you go to learn, you should not have different opportunities. And another value that we hold near and dear to our hearts is we are a community-first approach to childhood wellness. So what I'll show you in a minute and what our strategic plan is driven by now is that this is the community's plan, this is not the Board of Health's plan, this is not the fund's plan. We have been in this together and reusing this lens of community first. And the mantra that a number of our partners use is not us, but with us. Elevate the success of our early care and education provider and partners. Typically, we forget that they're on the front lines of the work and of the children we're hoping to reach. And so we do anything we can to elevate the success of folks who are really experts in the field. And above all, we are about collaboration over replication. We look at our coalition structure, so just to give you an idea, we have about 300 plus folks that interact with our coalition on some level, whether that's active participation in a monthly meeting on our listserv or come to the coalition as a potential partner and supporter and leverage of the work. And represents about almost 100 different agencies. So what's really important to us is that, we are not about getting together once a month and talking about programs. We are very action-oriented, and so when we bring our coalition folks together, and the way we've structured our meetings, they know that we are actively working as a group to advance our efforts. And so while, we may allow sharing for updates in a round robin or for people to put out programmatic literature, we look at policies and how we work together to help implement policies to improve health of young children and their families. We look at systems, and in our meetings, we're looking at how we can create networks, or what are the leverage points in our community where we can come together and we think about how we do things together in our community versus being siloed and separate. And really driven by the environmental aspect of our work, and the idea that the healthy choice should be the easy choice, and we do that in a number of different approaches. Very fortunate. The first early childhood wellness plan that was adopted in 2015, we achieved all of our goals and objectives of that plan, and so we started to think about what's next for the coalition. How do we really root ourselves further into the evidence and into the work? How do we maintain our community-driven approach? And so in 2016, we began a path down a new and an additional strategic planning process that has kind of really helped elevate this idea of community-first approach. And so we utilize the strategic prevention framework. The unique thing about this framework is it is traditionally a framework that is used in the substance abuse world. And we were fortunate enough at the time that our coalition coordinator was actually trained in this framework. So the unique thing about this is that we actually adapted this framework for early childhood health. And so the first thing that we did with our coalition members is we had a number of honest conversations about what capacity is, and we really looked at what the problems related to early childhood health were in the county and why those problems existed here. We spent a number of months planning and really addressing some of these issues and really making sure that we have conditions and interventions structured that help us achieve our goals. We began implementing our strategic plan, which contains both short-term and long-term projects. And in our strategic plan, and some of the results you will see today, is that we were extremely thoughtful about the evaluation component of the work beyond just traditional process outcomes. And then something that is constantly ongoing is that, we have this kind of line of sight to sustainability and how this work maintains momentum versus dropping off as people and as funding change. And so what we have now is a brand new 3-year strategic plan. It can be found on our website, and this was entirely community-driven and really reflects the priorities of the coalition and the issues that are here. The other thing that this process did, aside from giving us strategic direction, was through our discussions, we also expanded our health priorities. So we recognize that it's our job to help build these environments for children, and in order to do that, we must work together. And so we really spent a lot of time thinking about what we believe, if we healthy early learning environment, what that looks like. And so this was an expansion for us on the first plan. Healthy foods and physical activity remained components of the new plan, but we also broadened our scope to address a little early childhood health more broadly. And we do have components of social emotional needs, ensuring that families are engaged and that care is accessible for all kids in Cuyahoga County. At the end of the day, none of the work that we do matters unless our families are engaged with us. So this is really the driving force behind what we're doing now, and it's through the lens that we are the change agents that are needed to make these opportunities available. So I'm just going to highlight a few of the opportunities that have come about as a result of the networking and the work of the coalition. So we look in our healthcare lens. So we had a discussion about medical home, and that one of the reasons that healthcare accessibility is an issue in the county is because families lack a medical home. And so through the work of our healthcare work group, Clinic Children's Hospital was represented and started talking about their school mobile health clinic and how the mobile health unit is not utilized over the summer when school is out. And our one HEADS grantee happened to be there and was talking about what a challenge is to provide and to families to get screenings and then to get the paperwork and all the other associated services that families need in order to be their children to be eligible for care, including medical forms and immunizations and all those things. And so CEOGC, Head Start, and Cleveland Clinic Children's came together and they are now doing mobile medical homes for the Head Start families. And they're still working some of the issues out, but they have families that are coming, getting things necessary to be able to receive care, and it's all being done on site. And so the burden on families to do this. Our Healthy Foods arena, we were at a meeting hosted at the Greater Cleveland Food Bank, and the food bank was talking about the mobile markets that are provided at schools. And one of the owners of an early care and education center was sitting in the room and said, hey, why not here? Do you do this at early care and education sites? And the answer at the time was no. And since then, the Food Bank and Education with Imagination, which is located in the Union Mile area, gone on to develop a partnership that's now 2 years in the making. And once a month, they distribute over 4,000 pounds of produce to families not only within the Education for Imagination, but also within the surrounding community. So on average, servicing about 90 families a month just from this partnership through the coalition. And a family engagement, we're fortunate enough to have Noodle Soup Print. They are a healthcation company located in Cleveland and the Cuyahoga County Public Library, particularly the youth outreach coordinator who manages the toy lending library for families. And so what they've done is they have now integrated the Noodle Soup physical activity education materials into the toy lending library, which reached over 28,000 families last year. And so now we have thousands of families being reached with consistent childhood health and wellness messaging that was not happening over a year ago. So it's been a really great networking opportunity and really has helped enhance connections across systems and programs to really benefit young children and their families. And from our members' perspective, how they see this coalition as being beneficial. So as you can see here, we've been able to serve as a bridge between providers and the medical community. It's impacting folks within the organization in terms of their ability to promote healthy eating and activity. It's really beneficial, as I just talked about, in getting partners involved and collaborating and moving forward together as opposed to separately. And from a provider perspective, staff members are even learning about creative ways to assist parents in implementing snacks and meals at home. So it's been kind of this really robust success that we've had across a number of our initial goals and objectives, and so it's really a privilege to represent this body of work and to continue to help support and see their momentum grow. Finally, for the coalition, are actually now fortunate to be partnering with Dr. Chris Economos and her team at the Friedman School at Tufts University on a research project. For this, we have pulled a smaller group of our coalition membership together who were actively involved in the strategic planning process and who also actively participate in coalition meetings. And we are going to start to look at how our work impacting the community, and we'll be using systems science to do that, particularly group model building. So, working within our own mental models of how the systems are integrated or not and how the systems function together. And so this process is going to allow us to do is kind of view our system, identify places where we can intervene, and set our priorities for action. So for us, this is kind of both in the implementation of the current strategic plan, and then at the end of this will give us some priorities for action for the next iteration of the strategic plan. So we're super excited about this new partnership with Tufts and to further understand how our work is diffused out to the community and how we can intervene in the system in a more upstream way. More to come on that. The second area that we work is what we call Ohio Healthy Program. Ohio Healthy Program is an early childhood obesity prevention program that comes to us from the state and works with all interested ECE providers implementing and technical assistance on policies, menus, and family engagement. So 4 parts to becoming and being designated as an Ohio Healthy Program. The first is to attend all of the Ohio Healthy Program approved trainings, and I'll go into more detail about those in just a minute. A program has to implement and adopt at least one policy to ensure healthy practices are maintained within the early care and education program. Site must align their menu with the menu standards, and they must engage families around an Ohio Healthy Program topic. The two most important things to note is Ohio Healthy Program is 100% voluntary. This program goes above and beyond the state minimum requirements for licensing, as well as the Child Adult Care Food Program. And so a program that gets designated as OHP truly is committed to improving the health of their kids and going above and beyond is currently being required for them. And this designation must be maintained annually, so this is not a one-and-done designation. Sites have to commit to these things every year if they want to maintain their designation. Training requirements, we have 3 sessions. One is called Healthy Habits. It's 4 2.5-hour sessions. The requirement for this is that 1 staff person from each age level represented within the Early Care and Education Program must attend. So if you serve children ages 0 to 12, for example, an infant, toddler, preschool, and school-age teacher, at least 1 person from each of those age groups must attend this training. Session is Healthy Menus, which is a 2.5-hour training, and we require the staff cook or menu planner to attend this training. And third session is for the administrator, and it's a 2.5-hour training on what it means to adopt a healthy policy and how you go about doing that within a program. So all it's 15 hours of Ohio-approved professional development for ECE providers, and Cuyahoga County, we currently do this through in-person trainings. Nice for the programs because this program is offered by our agency free of charge, so we do not require folks to pay to receive this training. The OHP requires policy implementation. A site must adopt 1 policy or healthy practice, and so what we do is provide them with a policy handbook. We have a discussion around goals and objectives for the program and what they're hoping to address and adopt. So it could be a healthy menu, it could be a healthy beverage, it could be more physical activity. And so we work with them and through the policy guidance book on what some appropriate policies would be that they would then adopt. The image you see on the bottom of this are just a few examples of some of the things that we work with them on. Requirement is around the menu, and in order to be an Ohio Healthy Program, an ECE provider's menu must meet every single one of these requirements. So they must offer a different non-fried vegetable every day, a different fruit every day in a 5 period that does not include juice, whole grain every day, fried food no more than 1 time a week. In the fried food category, that includes everything from tortilla chips to frozen chicken nuggets, fix, all those kinds of things. Only beverages without any added sugar or sweeteners, 100% juice no more than 1 time a day. Only offer cereals with 6 grams or less of sugar per ounce, and that's in alignment with the WIC guidelines. And no highly processed meat regardless of animal type. So these are things like salami, bologna, pepperoni, sausage, those types of foods. And the 4th requirement is a program must engage parents. We generally advocate that the parent engagement tie back to the policy they adopt. So if they're doing their own physical activity, we encourage them for their family engagement component to be something that also supports physical activity. And they do this through a variety of ways: boards, being demos, health lunch, newsletters, fit events. It's really driven by the program and what their goals are and what works for them in doing this. Work is centered all around these 13 key messages, which you see here. So we have parent handouts and posters that are made available to all of the programs that we interact with around these 13 key messages. So now what I hope to do for the rest of our time is really just provide you the data around Ohio Healthy Program, because we have a lot of it, and we're proud of our work over the last, since 2014. So this first set of slides looks at training, and what you'll see here is the growth of the program has grown leaps and bounds since we started in 2014, and last year we trained 145 different unique agencies in the Ohio Healthy Program training. We'll say is not unusual where we may get a program that attends the training and may not follow through with the designation. And sometimes that's just because teachers need hours in order to maintain their professional development credential, and so they just use this as a way to do that. I'm fortunate that a number of them do make the decision to go on and do the component of it. What that's like is in 2017, we trained 135 different individuals through the training, and that's how that breaks through by type. Not surprising that the audience that we're training the most is teachers, but it's because they're the ones that have to attend that 10-hour training, since they're ones directly in the classrooms with the kids. So that's all of that breaks out. When we look at our technical assistance outcomes, what I'll tell you as you look through this next set of slides is we're 6 months into 2018, and we have already surpassed all of the 2017 numbers that are reflected on these slides. So the program continues to grow every year. So what that looks like from a program reach perspective is in 2017, we reached just over 3,000 kids in care. So far in 2018, we are at 4,200 kids. I will tell you about our reach is that we're very fortunate that 2 of our Head Start grantee organizations in the county have actually made Ohio Healthy Program mandatory for their sites. And so that's one of the numbers of kids that we're reaching are receiving care. And then look at that across age groups. We're predominantly impacting preschool kids, but we do reach kids across the spectrum. Far in 2018, it's been about 2,500 preschoolers. So we're reaching a number of kids in kind of that crucial period of kindergarten readiness. And then we look at our policies, our menus, and our family engagement outcomes. So with policies, in 2017, a total number of agencies we acted with, 201 policies were adopted. So far in 2018, it's been 224 policies. So the thing to keep in mind with this is that programs are only required to adopt 1 policy, and I'll have some data later, but on average, our programs are adopting 5 policies. And so the year that we did this in 2014, of those 43 policies, 34 policies were at 1 site. So they are across the spectrum in terms of readiness to change, and capacity and all those kinds of things. But on average, we are working with a very highly motivated group of folks once they engage with us, so that's really great. See how this gets broken across the topic area. Predominantly, we're in the area of nutrition. How that usually will work is if a program has to make a number of changes to meet the OHP menu criteria, those are typically the policies that they're adopting. Again, so it is pretty seamless in the assistance process. So look at the percent increase in healthy foods offered. For us, we also think about this in terms of, kids in these sites now have more opportunities to consume healthy foods than they did previously. So we truly see the most improvement in whole grains, and we'll see that even more with the new changes to the Child Adult Care Food Program guidelines. But whole grains are typically the area we see the most change, but we also do see increases in numbers of fruits and fresh vegetables being offered to kids. So we look in the percent decrease or less opportunity that kids have to consume healthy foods, and so we see the change in fried foods, sugar-sweetened cereals, and highly processed meats. So this is a meat component were to us the last 2 years. For 2018, we're also looking at sugar-dense carbs. So we'll have that data moving forward to this. In terms of engagement, we reached almost 3,000 families last year through our work with the Ohio Healthy Program in 2017. At that number right now in 2018. So we will reach more families this year than we did last year. As we look at how our programs are engaging with families, the majority are providing newsletters and other take-home educational materials. We do a number of folks that conduct on-site events such as cooking demos, and then they send the recipe ingredients homes with families to replicate home, or we're doing family fitness nights or a health fair or some kind of other things. So in 2017, we were able to help 51 programs achieve Ohio Healthy Program designation. Actually received the updated list from the state today, and in Cuyahoga County, we have 3 programs currently designated. To give you an idea, as the state of Ohio, we have 259 programs designated, so we are by far the most designated sites in the state, and really speaks to the community and coalition and the funders kind of all coming together, and our goal is to make Ohio Healthy Program the way of doing business for nutrition and physical activity in Cuyahoga County, and the continued growth of this program really speaks to that. But beyond the number of 93, we also like to think about and see if programs, if we're able to maintain them and get them to renew this designation. And so we are successful once we have programs engaged. We are successful in maintaining the momentum and keeping them re-engaged through a reapplication every year. And so, those are all numbers that we're pretty proud of, and we have this amazing group of providers in our community that are really dedicated to this effort. So in the last 3 minutes, I'm going to show you our new evaluation, and then I'll go ahead and open it for questions. So, we really started to think about, are we really making an impact, particularly in menus and policies, and are we reaching the kids that we're hoping to reach? So while our work is countywide, and we will work countywide, we are hoping to reach kids in our community that need it most. And so the first thing we started to do was just looking at a series of maps around our designated sites and some outcome data. And then also asked ourselves the research questions. So when we look at middle school overweight and obesity rates, you'll see where our higher rates are, and then the black dots are our Ohio Healthy Program sites. And so this really speaks to, if we're trying to prevent these overweight and obesity issues in kids by the time they hit 7th and 8th grade, there's an opportunity for us to continue intervening at a younger age in hopes to impact these rates. So looked at it by poverty, and as you can see, we are reaching a high number of children and families and programs in our communities that experience higher rates of poverty. We also looked at this by WIC, and again, similar to poverty, we are reaching our communities with participation in WIC. And really, we looked at this from a food desert perspective, and if we start to think about providing opportunities for kids to eat healthier foods, are we reaching programs and children and families in neighborhoods that wouldn't have the opportunity to consume others? And so for the most part, we are reaching the food desert areas of our county. So we were really excited to see that. We then started to think about Ohio Healthy Program in terms of training and technical assistance and how the impact on menus, and then also on the comprehensiveness and strengths of healthy policies, and started to think out about what characteristics may or may not predict change. And so we were fortunate through our partnership with the Masters of Public Health program at CASE to have a student help us out with this analysis. And so the first thing we did is we looked at the number of centers we've interacted with from the start of our work through 2017. So that was 122 sites. And you can see we are still predominantly reaching preschoolers in the analysis, and we suspect that's from the environment in the Head Start programs to work with the Ohio Healthy Program because they're very large sites. Then looked at these 122 Ohio Healthy Program designated sites across the state. So if you're not familiar, Ohio has Step Up to Quality, and any site that achieves a 3-star rating or higher is considered a high-quality early education program. And so since our inception, we predominantly working with either non-star rated or up to 3-star rated sites, but we do work sites across the quality continuum. And majority of the programs that we interact with are center-based programs. We do with home-based programs. We're one of the few organizations in the state that do, and we actually, through our MORS funding, are targeting home-based providers right now. Data that we have from the state level tells us that if you get a home-based program designated, they're actually more likely to renew than a center-based program, and so we think there's a lot to be learning there. So we get asked all the time, how do we know if we're impactful or not? Question we asked ourselves is, does training and TA delivered to ECE providers produce significant changes in the number of healthy policies? And the answer to this question, as you can see here, is yes, that OHP is an effective intervention to increase both number and strength of written policies related to health within a program. To assist, we use an evidence-based tool called the WCAT, which stands for Wellness Child Care Assessment Tool. It comes from the Yale Rudd Center for Food Policy and Obesity. It's a quantitative tool that allows us to strength and comprehensiveness. On average, we see a 10-point increase in comprehensive score based on the Wildcat through our technical assistance, and here we're able to show statistically significant increase in total number of policies, which again, on average, our programs are adopting 5. And asked ourselves, does training and TA delivered to the provider we work with produce significant changes to menus that go above and beyond CACFP? And we can say overwhelmingly that the answer is also yes. Based on analysis for the folks we interact with, we see statistically significant increases in whole fruits, vegetables, and whole grains, and we see statistically significant decreases in fried foods and servings of juice. So OHP is a very effective intervention in terms of making changes on menus. We think a little bit then about what are characteristics of centers that might have poor initial policy scores on the WCAT, meaning that are not very comprehensive nor are they very strong. And what we see is that our non-star rated and our lower star rated programs typically have poor initial scores on this assessment. And for us, to reiterate the fact that while we work across the spectrum of the star ratings, that technical assistance can be most beneficial to the programs that are non-star rated or are lower on the star system. And then finally, we started to think about what some characteristics that are predictive of change within our work. And for here, we just point out that our home-based programs are most likely to see positive changes to their policy handbooks as a result of our intervention. And so for us, just kind of really hit home the fact that we knew home-based programs were a really good return on investment, and it just reiterates for our targeted and outreach and focus in this of care. And so with that, I will just say thank you very much for listening. I know there's a lot there. These are a number of different ways that you can stay engaged with us. We have our website. You can email us at info@earlyageshealthystages.org. We're on Facebook. We're on Twitter. On the website, you're able to sign up for our newsletter. And in case any of you are super interested, our coalition meets monthly. Our next meeting is September 14th at 9:30, and we'll be out at the Educational Services Center, Cuyahoga County and Independence, focusing on the social-emotional priority and screening a video. So with that, I'll open it up for questions. And again, just thanks for your attention.
Yeah, Allison, so much for such a great overview of all the wonderful work that's happening in early ages healthy stage around improving wellness for the youth, for young youth in our county. If you do have questions, please feel free to chat them in right now. I have one question. So the early ages healthy stages focuses on 0 to 8 years old. Are there any sort of initiatives or any planned initiatives for kids that are 8 to 13 or that as a applying model to adolescents?
There's certainly an opportunity to apply the model to other and I will tell you at the state level, there's conversation of addressing the older group, kind of a gap for children ages kind of 8 to 12 that may in care before or after school, and there's not a whole bunch of health-related initiatives around that age group. We went with the state who defined young children as 0 to 8, and that really came from our provider that we needed to expand into the up to 8. So it could definitely be duplicated, and to my knowledge, there's not anything going on locally I'm aware of. I could be wrong. So if there is somebody, please let us know. We'd love to partner and leverage and collaborate with you. But yeah.
We have one question in here. So it says, will we be able to obtain slides in a recorded version for coworkers who are able to attend? The answer is yes. At the conclusion of the webinar, we will post the slides in a recording on the Better Health Partnership website. So we will look for that in the upcoming week. And if you have any questions, feel free to ask that. We have another question.
So I was just going to ask, this is a great presentation. I was just going to ask a little bit of an extension of what Jonathan was saying. He was about 8 to 12, but I know when you showed the data, it was around the high rate or the highest group is the preschoolers. And so I was just curious, what are your thoughts around are there more preschool programs than there are kindergarten programs? Is it just that, I know you said they're incentivized to participate in an OHP program, but are there challenges to getting kindergartner or kindergarten schools participate, or is there, I was just curious what you thought might be challenges there and if there's a way to do more in that space or not.
So Ohio Healthy program in general, lift is the training piece of it, because of the hours, and it's particularly hard to get. So we do our best to help mitigate that by, we host training out in the community. We do them on evenings and on weekends, and if a program has enough of space, we'll come on site and do them during the day. We really do try to meet folks where they're at. I will say the great news for us is we have such an amazing network of programs now, and so we have to do very little recruitment, and it is very word of mouth about the benefits and the support that people are given through this process. The other I'll say is, in addition to everything I told you about, we do give them incentive package for their program. So meaning it's class materials and education materials that they can use. So we give them hula hoops and parachutes and food models and storybooks and handouts. And so we actually already have a wait list for our training in the fall, our trainings when they kick back up again. We'll see how it goes is the trainings are about to go online, and so we may get some of that challenge for providers that may be cautious because of the training component. But I will tell you that from the folks that we work with, they actually prefer the in-person because it's networking and it's an opportunity to share with peers versus sitting in front of the computer. So I think there's a role for both. And I think that our community has just a really amazing opportunity to really show to the state how this can make change in a community.
We have a couple other questions here. How does this work interact with the pre-CLE initiative?
Pre-for-CLE is a member of our coalition, and Pre-for-CLE is also a member of our project with Tufts, and so we make every effort to kind of partner with our high-quality initiatives in the county, and we try to bridge that gap and show the connections between early childhood health and kindergarten readiness. And so Pre-for-CLE has been a great participant on our coalition and in our work since we started, and we continue to just cultivate that relationship and excited about the conversations that we have with them.
Okay. Sort of a comment here too. So I think this goes to the question about programs for kids being age of 8. So catch programming, after-school nutrition and physical activity education is at a lot of after-school sites through the Hunger Alliance. Locations are often tied to grant funding, and it reaches kids K through 8th grade. So that's another source. And then we have one last question. What are some of sort of calls to action around advocacy?
Oh, they never end. I was actually having this conversation this morning. So, one very simple that I think gets lost a lot in a number of programmatic initiatives is fear of young children are not considered an audience. And so even just as we think about things, so the conversation I was having this morning was about a shared use site, and we are super fortunate in this county through other funding and other initiatives that we have a number of opportunities for folks to engage with physical activity. But those sites are not necessarily geared for families with young children, and so even advocating for initiatives and programs and things when our is thinking across the spectrum and not just focusing on adults or not just focusing on adolescents, but how do you make these wonderful assets available to everybody is just one of my initial things. I think we still have opportunity to really help bridge the gap and paint the picture around how focus on early child health is a future force issue. It's a future high school graduation issue. There's definitely still a lot of work to be done in those arenas, and we're hoping that, we can get to a point to help contribute to those conversations, and we're glad to talk and work with folks that are interested in engaging in those discussions.
Well, thank you, Allison, for all of your insight and sharing all the great work that's happening. We're at time, and so if you had any further questions, the email address is up there, so info@earlyAgesHealthyStages.org. We will have the recording and slides up available within the next several days, so please look for those on the Better Health Partnership website, betterhealthpartnership.org. And again, thank Allison for her time, and for all of you joining. Please remember to complete the survey at the end of the call. Thank you.